I was incredibly impressed when I interviewed here with how nimble the residents described this program being in terms of being adaptable to changes that residents proposed. Our program leadership really want this to be a good learning environment for us.
One of the things that really drew me to the program that I have not seen when I interviewed at other programs, we have the trainer-trainee pairing. You have someone literally walking you through everything.
We have a special culture when it comes to the training environment where there's a mutual respect.
We get into the operating room right away at the beginning of intern year. By the end of first year, we're doing laparoscopic hysterectomies and repeat C-sections as the primary surgeon.
We have great, robust training in OB and GYN, and as a level 3 NICU, all of the patients are transferred to a higher level of care at Kaiser Oakland. And so oftentimes we're managing high-risk obstetric patients.
We get to know our faculty really well. We also get to know the scrub techs and the nurses and the midwives, of course.
We have a partnership with Highland Hospital, which is the Alameda healthcare system in the East Bay, and that allows us to service 2 different patient populations within 2 different healthcare systems. They actually have a level 1 trauma center, which is a great resource for us.
So you bring together this magical combination of training and experiences and interactions with patients and our attending physicians being able to work and serve in both settings. It's quite fun.
I love the patient population that we get to work with here in the East Bay in terms of race and ethnicity, in terms of socioeconomics, the LGBT patient population.
Kaiser Permanente supplies residents with a lot of tools they need to help get research done.
By the end of my research year, I was publishing in JAMA with my research mentor, which I never had thought would be something I would achieve as a resident.
When I interviewed here, this was the place that felt like home. It felt like a program that I could learn and grow in, be really comfortable in, and develop into the kind of clinician that I want to be.
Our program directors are essentially mom and dad. We do call them that. They're very warm. That extends to the rest of the faculty. I know most of my fellow residents' kids, their partners. We hang out. It's really a special place.
Going forward as an attending, I think I will definitely be able to take care of patients in a way that captures health equity, but also thinks about them as individuals.
This place chose me as much as I chose to be here. So it's much like a partnership. And I feel very privileged to be in such a wonderful, inviting, welcoming place to train.